Breathing is not something most people think about. In fact, you just take it for granted every day. But if you are struggling to breathe, it is the only thing that matters. Taking one breath after another is a matter of life and death. And you may not know it, but you need your respiratory therapist. In today's world, lung problems are on the rise and respiratory care is among the fastest growing specialties in healthcare.
Respiratory care in Oman started in 1991 in Royal Hospital with one RT, and gradually we increased. Now we reach up to 60. We're covering all over Oman.
Respiratory therapy is one of the important supportive services for all critical areas for pediatric, adult and neonates.
The aim of respiratory therapist is to improve the respiratory care services in the hospitals. At the same time, we are aiming to improve the utilization of the respiratory equipment in the hospital.
Respiratory therapists are needed in just about every facet of the healthcare system. They are specifically trained to assist physicians in the care of the patients, from diagnostics and patient evaluation to treatment and rehabilitation, from physician consultation to patient education, from rapid response emergency care to long-term case management. They assist in diagnostic procedures, administer oxygen and breathing treatments, conduct pulmonary therapy, teach home care to patient and family members, and also care for patients on mechanical ventilators.
Respiratory therapists are an important part of the intensive care unit. They are the experts in managing, maintaining, and connecting the patients on the sophisticated mechanical ventilators about which they have an in-depth knowledge. They not only help in maintaining these ventilators, they also know the process of getting the patients out of the mechanical ventilator.
In all variety patient cases, usually focus in respiratory disorder and sometimes cardiopulmonary as well.
They work with us as respiratory physicians that we are. They are our hands and legs and eyes for patient care. So respiratory therapists work with us, coordinating all the orders in regards of machines that are being used on patients, and they take care of the machines in every aspect of it and how to go about it, stepping up and stepping down. They are very professional services that are provided by each of the respiratory therapists. It is not just a job like a nurse to take orders and just make an execution of medication. It is an art, and together with them we make lives better.
The art is really important. They are coming with a portable ventilator and we are shifting for CT, we are shifting to other hospitals.
Art is a very important part of our hospital. They help in terms of our respiratory procedures, and we do have a lot of critical patients who need their expertise. And it's a pleasure working with them.
Respiratory therapists have a big role in managing our patients in day-to-day ventilating care of our patients in initiation of ventilation, and also for the weaning of the ventilator, weaning of the patients from the ventilator. They play a big role there. We always consult them. Patients on chronic vent, we also take their help in deciding which patients can be weaned easily and which patients cannot. So we are very thankful to our respiratory care department for their continuous support during the care of the patient.
They have their extended services outside in the ward as a part of a critical care outreach team. They help us in knowing which patient is bad and is not doing good in the ward. And they help us in early resuscitation, all these and other activities. We have patients on ECMO in our hospital, and they also help us in. They also are a part of the ECMO team in the ICU. So they play a very vital role in the management of patients in the ICU.
They are reliable, they are confident, and most of all, they are always available whenever we need them. They never hesitate to help us. They never stops from teaching us, and they added so much in our knowledge, in our skills throughout these years since 2010.
Respiratory therapists are also experts in managing the patients on the non-invasive ventilators. They start by choosing the right patients, connecting them to the non-invasive ventilator and getting them off the non-invasive ventilator, which is called the process of weaning. Longer the patient is on the mechanical ventilator, the worse is the outcome. So by providing a continuous care to these patients while they are on the ventilator and giving a protocolized management, they help us to get the patients out of these ventilators much faster than required, and thus leads to better outcome in the patient.
They are also sharing in the management of patients during care of tracheostomy procedure and also during bronchoscopy. For the patient during this procedure, they are sharing also the doctor intensivist during this procedure.
Okay. بسم الله. وجود أخصائي العلاج التنفسي من ضمن الطاقم الطبي في وحدات العناية المركزة شيء أساسي في ممارسة الطب الحديث، حيث أن الفشل في وظائف الجهاز التنفسي من أهم أسباب دخول المريض إلى لوحدات العناية المركزة، ويكاد لا يخلو أي مريض في العناية المركزة من الحاجة لنوع معين من أجهزة التنفس الاصطناعي. مستشفى الجامعة من المراكز الصحية القليلة في السلطنة التي عملت على ضم طاقم العلاج التنفسي إلى كوادرها في وحدات العناية المركزة، بحيث أصبح لدينا فريق متكامل من أخصائيي العلاج التنفسي. وقد لاحظنا ولله الحمد نقلة نوعية في العناية بالإضافة إلى العناية الروتينية يساعد أخصائيي العلاج التنفسي في تسريع عملية فطم المرضى من الأجهزة التنفسية، وهذا يساعد بسرعة شفاء المريض وخروجه من العناية المركزة، وبالتالي في توفير أسرة في العناية لمن هم بحاجة إليها. في غالب الأحيان أيضا يوفر أخصائي العلاج التنفسي الرعاية للمريض بعد خروجه من العناية المركزة في الأجنحة حتى يتم التأكد من عدم حاجته للتنفس الاصطناعي، وهذه المتابعة ممن هم على اطلاع ودراية صمام أمان للتنبؤ بأي حاجة لرجوع المريض إلى وحدة العناية المركزة ومنع التدهور المفاجئ في حالته.
Patients in need of respiratory care can be literally anyone of any age, from pregnant mothers who is on delivery and is short of breath, helping newborn babies get their first breath, premature infants who need a ventilator to breathe, young children with asthma or other respiratory diseases, adolescents whose breathing is impaired due to trauma, adults with sleep disorders, people with smoking problems, older people with chronic pulmonary diseases, and for all those people who are taking their last breath.
When I joined here, the RTs, I came to know that the RTs were not allowed to wean patients off the general ward. They were only allowed to review the patient and chart the patient. So as the doctors gain confidence, as the anesthetists gain confidence on the RTs, that they are capable enough to handle the patient outside, and the responsibility started building up. So we started from 6 patients. We were given very critical ill patients whom the anesthetists were reviewing previously, and we used to wean those patients off, follow up those patients, start non-invasive ventilation and post-extubation care.
Being a respiratory therapist makes me proud day by day, as it shows the effectiveness of working together as a team in providing quality care for patients and giving them back their normal life as human beings by breathing well. So let's all breathe better
As
together.
respiratory therapists, we are involved in Code Blue, and we are in charge of the airway. And respiratory therapist is very important profession to be in the hospital because without breath, without air, nobody can survive.
We are honored to be a member in respiratory care services in Oman, and we are looking forward for the development of respiratory practice and increase the quality of care for the patients who are suffering from respiratory diseases, whether they are inpatients or outpatients for home care. And we are looking for further development in respiratory care, in breathing better, and working together in future programs and researches.
As a respiratory therapist, I've been working in the field for almost quite a long time now, more than 10 years. I always equip myself to be always physically on the go, physically fit, because we'll never know what will happen inside the hospital for the span of the journey.
Being a respiratory therapist is hard to fulfill if we don't have the passion to give care to other people. The best part of being a respiratory therapist is to see and help people who's suffering with pulmonary diseases. And to add on it, we are here to help people who's having a hard time to breathe and managing ventilators for life support when patients can breathe on their own. Thank you.
Being a respiratory therapist, you must be motivated and enthusiastic to learn more every day. It feels very good for me when I got home knowing that I have a lot of people hearing dangerous and safe lives.
It's a challenge. We got to deal with different cases, and our relationship with working with the other locals and races here are very harmonious. We are hand in hand in dealing with our patients. We are able to respond to codes like the trauma codes, and cases are different every day, so we are able to practice our profession, so we are able to serve our patients.
Actually, my favorite area is adult intensive care. It's some area where we can contribute ourselves. At the end of the day, we feel like we did something for the patient, like job satisfaction maybe, no?
The career of every respiratory therapist begins at the hospital, where they sharpen their clinical and bedside skills. It is where they treat every kind of patients and every manner of pulmonary diseases and trauma. It is where they become proficient in the use of the very latest respiratory tools and equipments, and it is where they earn the respect and trust of physicians and nurses as a valued member of the healthcare team.
Doing a very good job reducing the burden of the staff, that we need more and more of respiratory therapists to help us in work. We need around the clock to do the burden of work. Just if I'm asking them to prepare the ventilator, they're doing job nicely and perfectly. And even I'm leaving sometimes the machines for them to adjust, telling them what to do. Sometimes we are talking with each other, negotiating or discussing what to do, and I'm happy with them.
I've seen a steady progress in the support from the respiratory therapist, and they're really doing a very good job. Now we have about 6 respiratory therapists. We have a lot of critical patients in PSU. Their support is wonderful. I really appreciate them.
I want to thank the respiratory therapists for being part of the ICU team. They are great help to us, and they are always helping us in managing sick patients and kids in the emergency department, the ICU, as well as the high D. Without them, we will not be able to save this many lives on the days.
A respiratory therapist is nothing but an easy task. Taking care of their patients is just about one aspect of their career. Being a respiratory therapist needs to be more than a respiratory therapist. With the clinical skills they have, a patient trainer, an educator, a physician extender, and of course, an equipment expert. They have to know and be equipped with the knowledge on how to operate and troubleshoot the latest respiratory equipments there is to keep up with advances and innovations on respiratory medicine. A knowledgeable respiratory therapist with very strong communication skills that can work as a member of a team in bringing out changes in the patient's lives is a rewarding job.
We did a lot of changes in respiratory care service, especially in Royal Hospital. We introduced a lot of respiratory equipment, ventilators. Like before, we have 1 or 2 types. Now we have different type of ventilators with high technology.
The respiratory therapists at Royal Hospital, we are trying to keep up with the global evolution of the respiratory care surfaces. For example, we have started using the high flow nasal cannula and bubble CPAP in pediatric ICU. In the same terms now, we started taking a big consideration of home care patients. We have around 8 pediatric ventilated patients and around 10 ventilated patients at home. In the same terms, we are taking care of around more than 150 home care respiratory equipment. We are communicating with the patients 24 hours if they need anything. We are able to do online troubleshooting with the home care ventilated patients.
There is increasing need for this subspecialty, and we encourage more Omanis to take it as one of the fields for specialization.
People should consider to join, they become a respiratory therapist because there is a lot to offer from both ends. You as people who are going to be respiratory therapists, and we as doctors who can work together to form a better future for this country. So I think you should consider that it is not just a technical job, it is more to do than machines. You only would know if you would ask more about it.
Before we don't have Omani RTs, and now we have around 12 RT Oman, and I'm hoping to get more and more.
For the very best respiratory therapist, the learning never ends. So if you are sitting beside a respiratory therapist now, you might ask them, why did you become a respiratory therapist? I am sure they all have different reasons. And one more thing I am sure is whatever respiratory therapists are doing, they surely are making a difference in the patients' lives.